All right, let's dive into the incredible tiny world inside your ear. We're talking about a system that does so much more than just let you hear. It's like an inner compass, the very thing that keeps you balanced and upright. So let's get into how we can decode this fascinating piece of machinery. You know that feeling, right? That sudden, really disorienting sensation of vertigo, where the whole room just seems to tilt and spin. Or maybe it's that persistent ringing or buzzing sound, tinnitus, that just won't quit. Well, these aren't just random annoyances. They're actually signals. And the source of those signals? It's deep inside your inner ear. We're talking about a place with delicate little hair cells, tiny crystals, and canals filled with fluid. The real key here is to understand how clinicians investigate this system to figure out what's really going on. Honestly, this whole process is like a piece of brilliant detective work. It really is. It starts with some simple, straightforward observations, and then builds and builds toward a super precise conclusion, using a whole toolkit of specialized tests to get to the truth. You might be surprised to hear that before any of the high-tech equipment even comes out, the very first clues often come from simple, hands-on tests. And these are not just some old-school relics. They give immediate, incredibly valuable information about the kind of hearing loss someone might have. So let's look at a couple of the classics, the Rinne and Weber tests. With the Rinne test, a doctor uses a tuning fork to see if you hear better through the air next to your ear or through the bone behind it. It's a quick way to tell if there's some kind of blockage. Then there's the Weber test. They place the vibrating fork right on your forehead, and that reveals if the sound seems stronger in one ear, which points them toward either a blockage or maybe even nerve damage. Okay, but to get a really detailed picture, we have to move on to pure tone audiometry. This is the big one. It's the definitive hearing test, what everyone considers the gold standard. It's all about precisely measuring the absolute quietest sound you can hear across a whole range of different pitches, from the very low to the very high. And the result of that test is something called an audiogram. The best way to think of it is as a detailed map of your hearing. It shows not just how severe a hearing loss might be, but it also reveals its specific pattern. And that pattern gives huge clues about what might be causing it. You know, hearing isn't just about the inner ear. The middle ear is absolutely crucial too. And that's where impedance audiometry comes in. This test, which you'll often hear called tympanometry, gently changes the air pressure in your ear canal to see how well your eardrum moves. What's cool is it's an objective test. The machine measures the response all on its own. You don't have to do a thing. And each result tells its own little story. A type A curve? That's totally normal. A flat type B curve could mean there's fluid behind the eardrum, or maybe a hole. Type C points to trouble with your eustachian tube. You know, the one that regulates pressure. And then you have these A's, or AD curves, which can suggest issues with those tiny bones in the middle ear, like they're too stiff or maybe even disconnected. Okay, so with these diagnostic tools in our belt, we can start to pinpoint specific conditions. Let's first take a look at what's called sensory neural hearing loss. This is when the problem is actually inside the inner ear itself, or with the nerve that connects it to the brain. Now, it's really important to get this. This type of hearing loss isn't caused by some kind of blockage. It's from damage to the super delicate sensory cells that detect sound or to the nerve that carries those signals up to the brain. This is the kind of thing we often see with aging or exposure to loud noise or certain medical conditions. And the damage from some of these causes can be, well, remarkably specific. Take a look at this chart. This is a classic audiogram for noise-induced hearing loss. See that really distinct dip? They call it a notch, right around the 4,000 hertz frequency. That is the absolute telltale signature of damage from being around loud sounds for too long. But sometimes this kind of hearing loss happens all at once. Sudden deafness is a rapid, completely unexplained loss of hearing, and it almost always happens in just one ear. And the experts are crystal clear on this. It is considered a medical emergency. It needs urgent treatment with corticosteroids right away. Now, what if the hearing loss is just on one side and it's slowly getting worse over time? Well, then doctors have to consider a totally different cause, something called a vestibular schwannoma. Now, it's a benign tumor, meaning not cancerous, but its location, right on the hearing and balance nerve, is what makes it a real problem. And this timeline really shows how that tumor's impact can progress. It usually starts with hearing loss and tinnitus, just in one ear. But as it grows, it might start pressing on the nearby facial nerve, which can cause some numbness or weakness in the face. And in the most advanced stages, it can actually compress the brainstem, which, as you can imagine, becomes a much more serious situation. Okay, let's switch gears and talk about the other major job of the inner ear, balance. When this system goes haywire, the main symptom is vertigo, that awful, disorienting feeling of spinning. But here's the thing, not all vertigo is created equal. The very first step for a doctor is to figure out if the vertigo is peripheral, meaning it's coming from the inner ear, or if it's central, which means it's a brain issue. Peripheral vertigo is often really intense and might come with hearing loss or tinnitus. Central vertigo, on the other hand, is usually milder, but it can be accompanied by some pretty serious neurological signs, like double vision or trouble swallowing. Now, by far the most common cause of peripheral vertigo is something called BPPV. Yeah, it's a mouthful, but the cause is actually surprisingly simple and mechanical. You have these tiny calcium crystals called otoconia that are supposed to be in one part of your inner ear, but sometimes they get knocked loose and float into the semicircular canals, which then triggers these false signals of intense spinning whenever you move your head a certain way. And because the problem is mechanical, guess what? So is the solution. The Epley maneuver is this really specific sequence of head movements. It's designed to literally use gravity to carefully guide those loose crystals out of the canal and get them back where they're supposed to be. It is remarkably effective and can often be done right there in the doctor's office. Another really important cause of vertigo is Meniere's disease. This one is caused by an abnormal buildup of fluid in the inner ear, and it's defined by what they call a classic triad of symptoms. First, these debilitating vertigo attacks that can last for hours. Second, hearing loss that seems to come and go. And third, a constant tinnitus or a feeling of fullness in the ear. Finally, it is so crucial to be able to tell the difference between two inflammatory conditions that can cause sudden, really severe vertigo. With vestibular neuritis, the inflammation only affects the balance nerve, so your hearing is totally fine. But with labyrinthitis, the inflammation affects the entire inner ear, so you get both that intense vertigo and a sudden loss of hearing. So you can see how this diagnostic detective work really works, right? It's a whole series of tests that can take a world of confusing, scary symptoms and narrow them down to one specific cause. And that precision, it's everything. Because getting that diagnosis exactly right determines the entire game plan. It's the difference between doing a simple Epley maneuver to fix BPPV in just a few minutes versus starting emergency steroids for sudden deafness to literally save someone's hearing. A precise diagnosis is the foundation for any effective treatment. It's that important. It's really a powerful reminder of these incredibly complex systems that are just silently working away inside of us every single second. And understanding how these signals are interpreted, well, it gives you a whole new appreciation for your body's inner compass. So, what might yours be trying to tell you?